This is Heart Rhythm TV, and I'm Daniel Aliesh here with an HRX preview. HRX is only 1 month away, and honestly, the hype is building. And for that reason, I'm joined today by my good friend and mentor from University of Michigan, Dr. Hamid Gambari. Welcome.
Thanks so much for having me. I should say we are so proud of all the work that you're doing with HRS TV here from your Michigan family. And thank you so much for having me to talk about HRX.
Oh, wow. Oh, thank you. That means a lot. Dating back to when I was a fellow, honestly, you used to talk to me about AI, your passion for AI, then, and it only has grown as far as application in healthcare and impacting patients. And I honestly think that there is a perception, right, amongst the broader community that, AI is a niche interest, it's an academic interest, and the truth is, the more you read about it, right, the more you realize that we all should be interested in this, right? It's already impacting us, and we're already using it, and it's only going to grow in time. And I think HRX as a digital conference is designed to appeal broadly to people because this is the future of healthcare. And so I want to ask you a question that probably is on the mind of many people when they see all this content out here. Like, what is AI, right? And why should we care about it?
That's a fantastic question. And I think that HRS and the broader EP community has been at the forefront of developing and implementing AI systems from the beginning. AI generally, the way I think of it, and the way it's been broadly defined, is a class of methods that aim to impart intelligence into machines generally. Now, the list of methods and subfields that fall under AR are considerable, and there's many, many different acronyms for them, like NLP, natural language processing, computer vision, robotics. But the one that has had the highest impact clinically has been machine learning, which basically machine learning algorithms learn complex relationships within data sets and in doing so abstract important concepts about the data that you have questions about. One subset that has a lot of clinical relevance for us in EP and generally in medicine is artificial neural networks within ML. And you can think of them as universal function approximators, and they can be used to approximate any function, no matter how complex that function is. Now, in the clinical context, the artificial neural networks are used to build functions that map a known clinical input, something like an ECG or coronary angiography, to a meaningful clinical outcome like risk of AF or future cardiovascular events. And there's many different subfields within that, like supervised learning, unsupervised learning, and something that you hear a lot about now, foundation models and large language models. And so that's generally the framework that we think about when we think about AI. And within electrophysiology and within our field, we have a lot of interest in this because it's been really used in our day-to-day practice, from interpreting ECGs to predicting important outcomes from our procedures and cardiovascular outcomes.
Well, thank you for that. And I want to mention to the audience that, the questions that I'm asking today and what we're discussing, it's actually part of a series of articles that Hamid is editing for Heart Rhythm Journal on AI that will be co-released with HRX. I think there's a whole series of articles in relation to what is AI, why should we care, all the way down to, predicting clinical outcomes, which will come out. And they will be linked into the description of this video. So moving on to our next question, I think this will be a simple question that we all can kind of appreciate, because we all manage AFib, right, in our day-to-day practice. I mean, if you're an EP, it's exploding, right? And then sudden cardiac death, right, is something that we all want to manage better, right? Because you want to minimize obviously the occurrence and honestly the morbidity and mortality related to it. So can you tell me, Hamid, what is the current state of AI as far as its ability to detect and treat both AFib as well as sudden cardiac death?
That's a terrific question. And there is lots of inputs that we use in our day-to-day clinical practice, like an ECG. You can think of it as an input that can be used to predict a certain outcome. So, for example, in the setting of when you're looking at an ECG as a clinician, you're looking at an ECG, you see a pattern that you recognize, and you label that as atrial fibrillation. Now, machines can really do the same thing. You can break down, for example, an ECG into uh, a time series data, and you input it into to a model, and then you have that model predict whether that input that you put in is atrial fibrillation or not. So at the very basic level, machine learning can be used to detect atrial fibrillation on what you already are seeing. But you could take it a little bit further. You can use ECG, that is a normal sinus rhythm, and detect subtle features that are not visible to the regular eye, and to see whether that patient will develop atrial fibrillation down the road, and potentially identify a group of patients that could benefit from more intensive screening modalities. Now, you can take that a little bit further, and a lot of the work that's one of our colleagues in Stanford is doing, and looking at a lot of the input that's going into our procedures, and predict which patients will benefit better from an AFib ablation, also tailoring that AFib ablation so you can get better outcomes long term from those patients. So basic inputs like ECG can be used really to augment what you're already doing, management of patients with atrial fibrillation. Now, obviously, there's been an explosion of consumer devices, and they not only can give you single lead ECGs, but they can give you other inputs like PPG, which is photoplethysmography. And you can imagine that there is an enormous amount of data that these devices are collecting, and that data can be used to detect atrial fibrillation in an ambulatory setting using very interesting and complex AI systems. Then you can imagine that you can put all of these also together, right? You can put ECG, PPG, accelerometer data that are coming on, and combine it with what we already know about the patient in the clinical realm, and then you can make very meaningful predictions about how the patient will do based on the treatments that you're delivering to them. So these same concepts that I described can also be used in sudden cardiac death. You can imagine that you could take a lot of that clinical information and input it into these complex models, and then get a prediction about the risk of future cardiac arrest in these patients, and then you can really tailor your therapies for those patients. So really, EP is at the forefront of doing a lot of these things, because a lot of the signals that are coming in are signals that we're really used to looking at: echocardiography, pulse rate, and ECG data.
So, I mean, to summarize, I think what I'm hearing, right, if you think of the volume of ECG data that goes through an average health system, right, it's just tremendous. And also think of the wearable data, which you allude to as well. So, machine learning applied to that will allow us to better detect AFib before it comes, right? And better identify those at risk and maybe intervene upstream. Also improve our outcomes with ablation, just to understand the subtle phenotypes for who benefits more. And then, really, hopefully prevent sudden cardiac arrest by identifying those subtleties as well. And I think that any electrophysiologist hearing that promise is going to feel good, because this is something that we all struggle with. Speaking of struggle, burnout, right? Burnout in healthcare, it's real, right? We have an explosion of administrative tasks, regulatory related to, maintenance of certification, Medicare, prior authorization. I mean, we all struggle with this. How can AI be applied to improve burnout within healthcare?
The good news right now is that AI, as it stands right now, is very good at doing the tasks that physicians really don't like to do. For example, ambient voice listening and dictation, revenue cycle management, billing, a lot of the back office work There's that can be really streamlined by AI. Lots of companies are tackling those, and I think that's really great news for clinicians because not only it can improve productivity, but also can really focus you on things that you really went to medical school to do, which is to care for patients and do the best you can in connecting with them on a human level. Now, obviously, as we advance more and more, I think the AI will move from back of the office to the front office. And I think right now we're seeing kind of the initial stages of building really comprehensive digital dashboards that allows you to organize your patient data in a very meaningful way. Really, AI can be used as I described and you said to really help you with diagnosis of disease, classification, and risk prediction. And I think those things really together by reducing really the back office work and kind of enhancing your experience with the patient can really help a lot with burnout.
So what you're telling me is I can go chat GPT, do this prior authorization.
Well, I'm not really, I can't really promote anything, but I think a lot of startups are really tackling that particular question that you're
No,
saying.
no,
I think,
all joking
yeah, yeah,
aside, I think that what you described, it will improve administrative
yeah,
burden and free us up to be with patients. I
yeah.
mean, and here's another, you alluded to this, right? The humanism in
Mhm.
healthcare. I think that there are a number of times with a patient, right, where there's something going on with in their life, and it's maybe not even related to EP. Well, they'll say, "Hey," and they come to a visit. They say, "I just wanted to see you to talk through something," right? I'm reassured just by talking this over with you. And honestly, some of the highest praise comes from an appointment where you spend most of your time talking and very little of your time doing. So to getting to the humanism in healthcare, I hear a lot about, AI and interacting with patients or, AI as far as applied to patient care. But, how can we maintain and enhance the humanism in healthcare while going down this journey with AI?
It's a fantastic question and something that we really have to be thinking about really from the beginning as we're building these AI models. I mean, as we have been talking about for the past 10 minutes, the digital platforms are phenomenal because they can really provide a comprehensive overview of the patient journey from beginning all the way to the end. But really relying only purely on data and then reducing the patient to bits is really not the ideal way of dealing with a patient. Really, the most, like you described, the most meaningful and impactful interactions are often the ones that you make a connection with the patient, you develop rapport, you really understand the patient just beyond numbers. And that's really that's where the role of the physician is. Really going back to thousands of years. That's really what physicians should be focused on. And I think AI has a potential to really allow us to really go back to the way that we were doing medicine before all this technology came and do things better. Now, this has to be a conscious decision that we make. And I think that conscious decision has to start from building these algorithms. We have to ensure that the intrinsic human values are embedded and encoded within the models from the onset. We really have to pay a lot of attention to make sure that the human interest and machine interests are aligned. So the alignment, human machine alignment is paramount from the beginning. And you have to focus on building systems that augment human connection, not hinder it.
I totally agree. I mean, I think that, so you're saying build it properly and build it to empower human interaction. Well, thank you so much. I've really enjoyed our discussion, Hamid. And for those watching, if you enjoy discussions like this, which I'm sure you do, HRX is really for everyone. Because I think that, you know, we need to move beyond thinking of it as a niche, digital health, AI, to really understanding that this is going to be everywhere. And I think to be at the forefront is to be at HRX, in just one short month away in Atlanta. So Hamid, thank you for joining me today.
Thank you so much for having me. I look forward to seeing everyone at HRX.